Approximately 10 million people in the U.S. live with osteoporosis. It's a silent disease, often displaying no signs or symptoms. Here with more is Dr. Felicia Cosman. Good morning, doctor. Great to have you on the show this morning.
Thanks for having me on, Stephanie.
If you could maybe just start us out by telling us exactly what is osteoporosis.
Sure. Osteoporosis is a disorder where bone becomes weak and fragile and is easy to break. Usually these breaks or fractures occur with just minimal trauma, such as falling on the sidewalk or banging into a piece of furniture. And of course, fractures have consequences that include pain, deformity, disability, loss of independence, and even death after some of the big fractures.
So what would, a patient living with osteoporosis, what would life be like for that patient?
That patient might have a deformity where she or he is stooped over and has an abnormal center of balance and doesn't walk properly, has chronic back pain, lost a lot of height. She falls and has a fracture of the arm or the wrist or the hip, or a rib breaks when she coughs or sneezes. And so her life is curtailed by pain and by fear of more fractures, by going to doctors and having treatments and sometimes surgery. And often people who have some of the big fractures never regain their normal independence, and many end up in a nursing home.
Mm-hmm. And
that's the downside of osteoporosis.
And also a silent disease, right? Oftentimes there are no signs and symptoms, right?
There are no signs and symptoms when it first occurs until the fractures occur. And it's kind of like, blood pressure. It can be high for a long time. You don't even know about it until you have a stroke. Cholesterol can be high for a long time. You don't know about it until you have a heart attack. Osteoporosis can be around for a long time, and then you finally have a bone attack or a fracture from this disease.
Well, there was a recent study done on osteoporosis, and what were those key findings? Because I know they say bone building treatments are important. What do people need to know about these findings?
So this was a landmark clinical trial in some 2,400 women who received either the investigational medication, abaloparatide, or placebo, or a leading competitor currently on the market. And the study showed that the investigational medication stimulated bone growth, stimulated the formation of more tissue, improved bone mass throughout the skeleton, and reduced the risk of fractures both in the spine and the rest of the skeleton very prominently and very quickly. This is great news for women who are suffering from osteoporosis and at risk for fracture.
Dr. Cosman, anywhere you can send us online to learn more about this great news and more information on osteoporosis?
You bet. For more information, consult the National Osteoporosis Foundation's website. That's NOF.org.
Be sure to check it out. And if you'd like more on what Dr. Cosman talked about, head online to our website. You can check us out at fox4morningblend.com.